One of the favorite diseases du jour is sleep apnea, meaning that it's become very popular to talk about sleep apnea. People know what it is nowadays. Many people know someone who has a sleep machine, a CPAP machine. You see them carrying them through the turnstile at the airport. Where's my snoring machine? You know, and we find that the oral appliances are a nice alternative. You don't have to plug it in. It's much like a mouth guard, fits in the mouth, and it holds the jaw forward and the tongue forward so the person can breathe through the nose and through the mouth and get good oxygen to the brain. Sleep apnea is when the tongue is so far back in the throat that the person is actually choking themselves during sleep. They'll wake up in a start, not even knowing that they wake up, catch their breath, and fall back asleep, snoring again, oftentimes. So a lot of times the wife or the husband is elbowing the person out of the bed because they're making so much noise with this snoring, and then all of a sudden it stops and the person is very quiet. They're not breathing. That's sleep apnea. We can make it better with an oral appliance. The CPAP is the gold standard. That's what the medical doctors will have you use. But it's very cumbersome because you have to carry it with you, plug it in the wall, a mask goes over your mouth or over your nose, and now you're attached to the wall because you're plugged in. Whereas an oral appliance allows the jaw to come forward, opens the airway, increases oxygen to the brain, and no sleep apnea or reduced apnea events through the night. Come to find out that there is a comorbidity. That's a term that means when you have this, you have this. And there's a comorbidity of sleep apnea with heart disease and lung disease. So some significant diseases that we all want to avoid can be avoided, or at least lessen the risk, by treating sleep apnea.